Hey, Dr. John Swetech here. We decided to make a YouTube channel for our patients to give them some extra information. We'll try to make these regular if they are a hit. Let's talk about blood pressure today. So there's a lot of confusion in society over what is a good blood pressure. There's a lot of contradictions and changes over time. So back in the day, they used to treat to get a blood pressure down to 120/80. As time went on, they realized this was actually causing more problems than it was helping. So the last international, I think it was international conference, they call it Genco 8, they kind of set a guideline at 140/90. It was interesting at this conference, they kind of went against beta blockers as a main form of blood pressure control. They kind of noticed in the elderly, beta blockers were causing falls, and this was actually causing more harm than good. So they kind of went with 140/90 if the person is not diabetic or if they do not have any kidney issues. So that being said, that's the resting blood pressure. That's when you're sitting for 15 minutes, nice normal posture, blood pressure cuff at heart level, 140/90 without other issues. So it got a little more complicated. Some of the specialists said, you know, that's too high. We're still having heart attacks and strokes and other issues. Let's set it at 130/80. So it kind of gets a little confusing, but the point is you need to individualize that to the patient and kind of go from there. Some people that get stressed out a lot or end up in situations where their blood pressure is going to peak a lot. Sometimes you might want to push them closer to the lower number, but that's kind of the starting point. So 140/90 for most people, 130/80 is usually a better goal, weighing things out. Make sure you talk this over with a doctor. A couple people get a little confused over blood pressure fluctuating a lot as well. Blood pressure is supposed to go up and down. Basically, blood pressure is the interaction of the blood flowing by, it's being pumped by the heart, and how it interacts with your blood vessels. If your blood pressure was stable, you would not be able to adjust to standing up, different activities. A lot of people will check their blood pressure and notice it's high one time, lower the next, and they don't know what they're doing. We actually try to, best case scenario, get a bunch of numbers and kind of figure out what the average is and get the average under that number. So it's fairly easy to get under control in most cases. It is very important to treat this. People ask, what is high blood pressure too? It's almost a man-made disease in a sense that back in the day we used to only live till about 20 or so, 20, 30, the cavemen, maybe a little bit longer than that, but now we're living longer. We realize that people that have higher blood pressure tend to have more heart attacks, strokes, damage to blood vessels, vision, things like that, kidney damage. So it's kind of more or less a risk factor that you can treat and get people to live longer and have less problems. There's plenty of options to get it under control. I always try to push for the lifestyle modifications, losing weight if you're overweight, watching the salt intake. But when we need medications, we have them at our disposal. So be happy to have you come in for an evaluation, or if you're already an established patient, we'll have try to put these up. Our number is 586-228-0400. You can also check our website at www.drswetech.com. That's DRSWETECH.com. Thank you. Let us know what you think. Obviously, these are kind of just general guidelines. Each case is a little bit more complicated. Every person, we treat people here, every person is different. So come on in, we'll get it figured out for you. Have a good day.